Hello once again, viewers. Welcome to Patient Life Matters. And today we have met again. And anytime that we meet here like this, we talk about patients, we talk about healthcare professionals, anything at all that is bothering our mind when it comes to healthcare. Anytime that I become a patient and go to the hospital, how I want the healthcare professionals to treat me, and also how the healthcare professionals also want our patient to behave when they also come to the hospital. Today we are going to go through a certain interesting episode that we are going to look at the code of conduct of NMC, code of conduct of nurses. There are some people who've been hearing it, but they don't actually know what it entails, and that is the reason why today we have picked it upon ourselves and we are going to go through for you to know when you talk about NMC code of conduct, what do they mean, what are they saying. When we talk about code of conduct, it is a certain that has been constructed or that has been propounded by NMC that tells nurses and midwives how to behave and care for their patients safely and professionally. They are just phrases that has been propounded, that has been, designed to let you and I as healthcare professionals to know how to care for our patients and to know how to, when we are caring for them, how we can care for them safely and also to act professionally. And when you look at it, they have four phrases, four statements or four words that they have designed, and that is what we are going to go through. The first one that is on their line, which is very interesting and I like it very much, is prioritize people. Prioritize people. People here, we are talking about patients, we are talking about casualties, we are talking about victims. It can also talk about you and I as healthcare colleagues. You need to prioritize the people that we are rendering the care to, the person that we are conducting that kind of procedure on. We need to prioritize them. We need to see them as human beings. We need to concentrate on them. Prioritizing. When you talk about prioritizing, we are saying put the patient first. Let us put our patient first when they come to the hospital. It was because of something that brought them there. It isn't that they came there just for fun. Hospital is not a supermarket, Hospital is not a place that we go and entertain ourselves. Anybody who comes to the hospital, the first thing you need to put in mind as a healthcare professional is that the person is sick. There is something worrying the person. Even if that person is coming to pay a visit to someone, take it that patient is that person coming to visit a patient is not in a normal state. If the person is in a normal state, the person wouldn't have come to the hospital. Do you get it? So anytime that we are doing something for these people, we need to put them first and you need to concentrate on them. We need to treat them with respect. There are some staffs or healthcare professionals who don't treat our patient with respect. They are also like you just because of something. Some of our patients are having higher ranks in their society, They are having higher ranks in their work site. Sometimes if they even bring their work, if they bring their certificate to you, if they even show you the kind of person that they are, it will surprise you. So we shouldn't have to know someone's background before we treat the person with respect. Even if it is a child, even if the person is a female, male, or wherever that the person is coming from. So we don't discriminate. So we need to respect the patient. We need to also make sure that we are treating them as human as possible. That is, you need to give them dignity. You need to ensure that the patient is being dignified in our hands, in our care. We need to show kindness to them. When you do this, it means we are prioritizing the person. We are prioritizing the patient. But if we neglect this, it means we are doing our work anyhow, and it doesn't show that we are professionals. Anytime that a patient comes to us, and then we are talking about prioritizing them, we prioritize them by treating everyone as human as possible. It is not a task. Some people concentrate on the task. Some people concentrate on what they are doing on the person than the person, him or herself, forgetting that that person too is a human just like you. Nti obi a yɛhwɛ ne biara no, ma yɛmfa ne sɛ yɛde yɛ adwuma na yɛyɛ. Yɛmfa ne sɛ deɛ nipa na yɛ deɛ ɔda hɔ no yɛ nipa te sɛ yɛn a ɛne yɛhwɛ nipa. So let us treat our patient as human as possible. When we are working on them, one thing that we do that shows that we are prioritizing them, we are putting them first, is by listening to them, listening to their feelings, listening to whatever that the patient says. Patients can communicate. They talk to us. Sometimes some of them cannot even open their mouths, but they can use gesture. They can use facial expressions to communicate to us. Let us look for those cues. Let us look for those actions so that we can act accordingly. It could even be that the patient is in pain, but you are ignoring it. It means you are not prioritizing the patient. You are concentrating on what? On your work, on your duty. It shouldn't be so. When we say you are prioritizing your patient, it means you are listening to your patient. You get it? Listen to them. Anything that the patient says should be treated as important. Do not ignore anything at all. Let us respect their choices. Let us respect their choices too. When we say you are prioritizing people, it means you are respecting their choices. A patient can make wrong choices, but let us respect it. Do not let us impose our choices on our patients, our values on our patient. What is wrong and what is right to us on our patient. Even though the patient can make, sorry to say, silly choices, but still, let us respect it. The patient knows the reason why he or she is doing that, because every behavior is meaningful and good directed. There is no behavior that is the person is doing it just like that. It means something. The person wants to achieve something. That is the reason why the person is choosing that choice. So when you see that, it left to us to come down and then explain that choice or ask the patient why they picked that choice. And after they have explained, then we also explain to them what we think medically, nursing-wise, what we think it will let them have their health back well, or it is going to endanger their health or put their health into jeopardy. Then we do that. We don't just tell the patient that, the choices that you made is wrong. No. Let us also respect their privacy. Let them know that, yes, when we are coming to them, when we are coming to work on them, we ensure their privacy. We ensure that if they are in a room or they are in a bay, their bed space has been screened. Let us provide privacy. Sometimes it could even be a conversation that you are going to have with them. It doesn't necessarily mean that just because conversation, you can say it anyhow, you can sit anyhow and start talking with the patient. No. At least let us provide privacy. Let us make sure that the place is a bit screened. The patient sitting up well so that we can communicate with the patient. If you are performing or if you are doing something like personal care, let us cover them well. There are some healthcare professionals, when they are bathing a patient or when they are conducting a wash for a patient, they just expose the patient anyhow in bed. If it is the face that you are washing, the question is then why the chest and then the lower part is being exposed? We need to cover from here and then wash the face. After that, we move to down. We don't just expose the patient. So when you move to the waist level, you wash the top part, and then after you have finished washing the top part and you are going to downside, you bring the cloth and cover the top part, and then you have your way down there. Sometimes we just expose them like that. Some of them do feel shy, but they can't say. There are some of them, though they are dementia patients, some of them are having mental problems, but that doesn't mean that they don't see. Sometimes they come to their lucid period. So when we are prioritizing our patient, it means we are also providing privacy. Do you get it? Or you can say privacy. We need to provide privacy for our patient. And sometimes some of our patients are very, very vulnerable. These people need to be protected. When you are prioritizing your patients, or when you are prioritizing people as the first NMC code of conduct, it means those who are vulnerable under your care, you are protecting them. If ask yourself, the person that I'm caring for, is the person having capacity? If such a person is not having capacity, it means this person cannot make certain choices for him or herself. You need to make sure that you are speaking for them. Be their advocate. Anytime that somebody abuses them, somebody says something to them, whether it's verbal, physical abuse, or whatever kind of abuse, whether it's financial, whether it's sexual, whether it is emotional or psychological, please, you need to be there. Speak for them. That is what we are talking about. That we are prioritizing our patients. We are speaking for our patient. We are putting our patient first in whatever that we do. Protect the vulnerable people. If it is children, if they are children, you need to protect their rights. Do not anyone abuse them. Do not let anyone neglect them. Sometimes patients can ring bells for a very long time, and healthcare professionals will be sitting there. This patient like that too much. This shows that you are not prioritizing that patient, but you are prioritizing what? The task, the work that you are doing. You go to the hospital to work on those patients, but not necessarily the task. But ask yourself, is my patient feeling comfortable? Is my patient okay? This shows that yes, you are prioritizing your patients. Never and ever discriminate. If you do that, it means you are prioritizing the people. You are prioritizing your patient. Do not discriminate against your patients. This one is coming from Africa. This one is coming from Europe. This one is a Muslim. This one is a gay. This one is lesbian. This one is a child. We do not discriminate our patient. Their private matters are theirs. Ours is their health, their well-being, for us to treat them well and put a smile on their faces. When you finish treating the patient is going and the patient is smiling and say, "Oh, thank you very much for what you have done for me." Come on, don't you feel happy? It means when the patient came to you, you prioritize the patient. It wasn't your task. Keep the patient what? Safe from what? From harm and abuse. We need to keep our patients safe from harm and abuse. How we hold our patients. When we are even administering medication, do you do the checks? We have 5 checks, we have 6 checks. We can even have as high as 10 checks now. Do you check them so that you do not give wrong medication to a wrong patient at a wrong time? A medication which is the prescription is even invalid. Do you check all of them before? Do we make sure that all the checks around their skin has been done, so that if they are having any cut anywhere, we have detected it so that we can take care of it. This shows that we are keeping our patients safe, and then we are preventing them from harm or abuse. Prioritize people. That is the first code of conduct for NMC. Prioritize people. When you are prioritizing people, at least when you go to the patient room, at least as simple as closing the curtains before personal care, it shows that yes, you are prioritizing the person. At least asking for consent before a procedure is being conducted, it means yes, you are prioritizing your patient. Anytime you do not ask for consent before you conduct any procedure at all on your patient, it means you are not prioritizing. It means you are not prioritizing. At At least it could be as simple as reporting any signs of neglect or abuse. Immediately you see it. You don't wait and go and investigate an abuse. You are not an investigator. Yours is to report it. Report any abuse at all, no matter how small it is. We will end this episode here today. We have spoken about prioritizing people as the first code of conduct of NMC. We shall continue with the next episode. Thank you. When you come on this program, what we say is just subscribe to it and share to your colleagues so that they will also know and learn. And when they go to the hospital, they will also conduct themselves professionally. Thank you and have a